here to talk about how you can take charge of your heart. Men and women. Probably 95% of what I'm going to say applies to men as well as women. We like to start out with a brief heart story. Each of us have a heart story. Becky has a heart story. She's a heart sister. I was 64 years old, just about a month away from getting Medicare. And I woke up one night, 1 or 2 in the morning, and I was perspiring, and my husband took my pulse, and he was going crazy. He called the EMT, living in downtown Savannah, historic district. The truck comes, rushes me to the emergency clinic at Memorial Hospital, and they gave me some kind of medication that calmed down a crazy heartbeat. And then early the next morning, they took an echocardiogram, which is like an ultrasound of the heart. Many of us women, the first time we experience an ultrasound is if we're a little bit pregnant, right? Yeah, and then looking at the baby. But this is an ultrasound of the heart, and they came back with a diagnosis. They said, you have hypertrophic obstructive cardiomyopathy. What the heck is that? Okay. I now refer to it as my disease.
Yeah.
What it is over some years, we have 4 chambers in our heart, 2 atria and 2 ventricles. The wall of the left ventricle thickens in the case of my disease. And so our heart is about the size of your fist, but I'm going to make believe that the ventricle is this big. So instead of having a nice big opening, it starts to thicken, and the opening gets lower and lower. And that all the chambers are important, but that's the one that pumps the oxygenated blood to the rest of your body. So, and unfortunately, you hear about this disease when you pick up the paper here in the hot South in August, and some wonderful young man or woman who's out on the football or baseball or something playing field or training, drop dead. They have sudden death. And that's because they had the same thing that I had, but their heart was pumping so very fast. In fact, one of my doctors said, you always see those scenes where they have the athletes running up and down the stadium stairs, to exercise and get in shape. Well, as my doctor said to me, going up and down stairs or any incline is the biggest stress you can put on your heart. So, yeah, so that's what happened. But then there were oldsters like me. So, I had, all my doctors were in Savannah at that time, except I had gone to the Mayo Clinic in Jacksonville, Florida, which is about 2+ hour drive, from Savannah, one way, so about 5 hours round trip. I had gone there because I had a 0-stage breast cancer kind of scare, and I'd had a lumpectomy for something called DCIS, ductal carcinoma in situ. Anyway, it's a 0, but, so I had gone to the Mayo Clinic, and they had done, I think a great job. Now, how many years later? That was 2013, so how many years later I'm okay as far as that's concerned. But I was established as a Mayo patient. So when the cardiologist in Savannah kind of said, I said, well, what happened? He goes, well, pretty much you often have to have a surgery where they go in and they clean out that ventricle. And I said, well, is it done here very often? And he was kind of like, not so much. So that's why I went down to Jacksonville. And then it wasn't like I was going to, die the next day. So I got the workup at Mayo. And yes, I got under my Medicare. Yay! 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 And then I had the surgery though at the big Mayo Clinic in Rochester, Minnesota, the mothership. But I've had all my follow-up at Mayo and Jacksonville. So that's basically my heart story. But as with many people, men and women, I've been having symptoms that I didn't know were heart disease symptoms. I was having pains in my back and kind of indigestion for a couple of years before that. And then I even remembered when I was giving birth to my first of our two children, Emily, back in 1982, after delivery and all, my doctor said to me, oh, by the way, Murem, you know, when you were in labor, I heard this heart murmur. You might want to have it looked at. Did I have it looked at? Of course not. I was a young mother, I'm busy, have another child, working, all that. So it was there, and it was the pressure of what was going on in that ventricle that was actually putting pressure on the mitral valve that was causing the murmur. I don't have any murmur anymore to speak of. So that's my heart story, and when I was at Mayo Clinic as a patient, I made it my business to meet the woman cardiologist who started the women's clinic, heart clinic at Mayo, and she told me about a group called Women Heart. And she said, well, it was founded by 3 women heart patients who felt that women needed some, you know, extra attention in cardiology. And as of today, it's a 25-year-old organization. And she told me about this role that you could take as a heart patient, because it's an organization all run by heart patients, that you could take training actually at the big Mayo Clinic that was paid for by Mayo and Women Heart. And I said, oh, well, this is in July when I had my surgery. I said, can I go? This October. She said, no, you have to wait at least 6 months after you had your heart attack or surgery or something. So in October of 2015, I took the training, became a Women Heart champion, and started Women Heart Savannah in Savannah. Now, it takes a village. The St. Joe Candler Hospital, because the St. Joe's Heart Hospitals there, were our hosts for many years and have been great partners with us. So I certainly didn't do it on my own. And then about every 6-12 months, I was able to recruit another Women Heart champion and another Women Heart champion, and then one even moved back home to Savannah, and all of a sudden we had another Women Heart champion. And then my dear friend Elaine, who I've known for 20 years, we're both Jersey girls, we moved to Savannah 20 years ago. She'd had some other health challenges, but she used to come and kind of help out at our support network meetings that Becky used to come to faithfully every month from all the way from here in Statesboro to Savannah. Elaine was a director at the YMCA, which is one of the places we met. And so she was almost like part of the group anyway, but she wasn't officially a heart patient. And then what happened?
And then what happened? And then what happened? Holy smoke. Well, Murem mentioned that a lot of times you have more than one thing wrong with you, right? You have some heart difficulties, you might have diabetes, you might be a little overweight. Those 3 things together equal metabolic syndrome, okay, which put you at a higher risk of having a heart attack. Now, I met Murem through her mom. Her mom was my personal training client in 2008-ish. Lo and behold, Murem started to come to some of my classes, and I said, you know what, we have to get together because we just talk too much. and so we did, and we have been very close friends ever since then. I am a walking miracle. I have a congenital heart murmur. So I passed around the little heart models, which are a little bit smaller than most persons' hearts. You can measure your heart. Your heart is maybe about 2.5 inches, 3.5 inches long, and about half of that in width, okay? So if you imagine this in your own heart, every time your heart says love, this baby is squeezing the blood through the rest of your body. Mm-hmm. When it says dub, it's taking a rest. Love, dub. I was 25 years old and ready to sign up for my first gym membership. And I was told that they had to do an EKG first. It was a long time ago, so that really surprised me. I had a heart murmur. It was really no surprise because my mom had one. And she went through her life pretty well. She lived to be 87. The next time that I had a significant reading on an EKG was about 5 years ago. Also a surprise. I mentioned other things that can carry you through life. It's called comorbidity. One of my comorbidities is some lung problems. I was getting set up for a bronchoscopy. The doctor wanted to, put a tube down into my lungs to see what was causing my breathing problems. And my nurse stepped out of the room for a moment. And when he came back, I said, you know what happened? My heart was beating like crazy. I could see it on the monitor. And as I was describing it to him, it happened again. He called in my pulmonologist right away, who said, what do you say we postpone the bronchoscopy? I'm sending you upstairs. And 5 days later, I was sent home. The next EKG said something like septal infarct of unknown origin, and that never happened before that. So sometimes things kind of creep in. I was purely asymptomatic, as they say. I didn't have any symptoms of a heart problem. So now I am a heart sister. You and I travel around a lot.
Right. And I'm glad you brought up your mom, because actually, my disease, well, now I take the O out because they remove the obstruction, so it's hypertrophic cardiomyopathy. It's pretty much always an inherited disease. So, and then I went back and thought, oh yeah, they told my father this and he was on medication. So they didn't really know what it was. Then I remember my grandma, his mother died on the young side. So I, every once in a while I go, well, thanks, Dad. And a lot of heart disease is, and the things that put us at risk are inherited. High blood pressure, high cholesterol. There are lots of people out there who have like 2% body fat and have very high cholesterol because they've inherited it. And over time, there are medications and treatments for a lot of these things, but not everything. And the key thing about the heart, and I think we'll sort of segue into the one set of info I want you to remember is about having a heart attack. When you have a heart attack and your heart is damaged, the great scientists we have today still do not know how to reproduce heart cells. We can't rebuild our heart. They're getting closer with kidney, and as maybe some of you know, you can live with one kidney instead of two, you can live with part of a liver and so forth, but you cannot live without a heart, and it cannot repair itself. So what we want you to think about is if you go in your bag, yes, yeah.
So we have these red bags of,
Well, red
not
bags of
courage,
courage.
but of, and it is, it takes guts to deal with chronic illnesses. But you'll notice that on the side piece, the folded up side piece, there are common symptoms of heart attacks.
And also take out this bookmark too, please, because I hope you go home and you put it on a magnet on your refrigerator.
So it lists them as, chest pain or discomfort, pressure in the jaw, back, arm, or neck. But you may not feel that at all. And then you might also feel a little nauseous. You might feel really tired, so fatigue sets in during the day. Shortness of breath. If any of those happen, you should be your own advocate and speak up about it. Call your doctor and say, I'm having these symptoms and I'd like you to check my heart. When can I come in? This little baby stays on my refrigerator day in, day out. And every once in a while, I'll take it out to see what those symptoms are, okay, as a good reminder. Because it could happen in a blink of an eye, when you least expect it.
Right, and actually you flip this over and we've got lots of extra, we have extra bags for other parishioners after we leave, but also we have extras of the bookmark that you'd like to take and give out to others, because this is, or have one in your refrigerator, or have one in your purse. It actually, yes, you can call your doctor, but we actually start out, we up the ante, call 911 within 5 minutes or less when you start to feel any of these symptoms. And some of these symptoms we talked about are somewhat unique to women: the back pain, the jaw pain, the overall fatigue, the classic Hollywood heart attack, the men's heart attack. Yeah, we have that listed here because that's the chest pain, pain in the left arm, but we women have these other symptoms. So call 911 and say, I think I'm having a heart attack. Another key phrase could be, I think I'm having a stroke, which are different symptoms, of course. And stroke is certainly part of the whole cardiovascular set of issues, the numbness on the side of the face, the inability to speak. Do not drive yourself. Now, I know it's easy for us to say, because we're in Savannah and we're not ever more than like 15 minutes from an ER. If you go to Savannah, where is your closest ER?
Statesboro.
And so how far of a drive would that be?
About 10 miles.
Oh, okay, so you're close, so your EMT trucks come get you. Because what they do is they hook you up right away, and they're monitoring you, and they can tell, if you in fact are having a heart attack. The heart disease is the #1 killer of women and men. Women and men, okay? Breast cancer is #6 for women, in large part because there's been some, I see people would think here too, because of all the diagnostic and early treatment that's going on in, many of the cancers, but including breast cancer, which obviously strikes women. Don't drive yourself, and don't even ask a friend or neighbor to drive you, because when they hook you up, they can tell that, it looks like this could be the sign of a blockage, and they get what's called the cath lab, the catheterization lab, all lined up. And of course, you go flying into the ER, and they take some more vitals, and then they may put you in the catheterization lab. The cath lab is where they put the device up through your vein and take a look at the arteries around your heart and determine whether or not there's a blockage. And I see some heads going, yes. And it can happen to anybody of any age. Now, I mentioned my heart disease being familial up through my father's side. My son at age 35, an athlete, amazing shape, was having pains, angina, and he's up in Atlanta, and I was just urging him, just go in. When he went in and had the catheterization done, his LAD, the widowmaker, the big artery, was 95% blocked. And he has 1 stent. Again, low cholesterol, we're still trying to figure out what on earth happened with him. So it can happen at any age too. But anyway, so you're in the truck, you're in the hospital now, and they know what they're doing, and they're giving you the best possible treatment. While you're waiting a few minutes for the EMT to come, and just have it around, full strength aspirin. Take one, because that'll help prevent blood clotting, which is another issue. And not coated, an uncoated aspirin.
So some of the aspirins come with this coating. It's called an enteric coating. It's supposedly supposed to help you swallow it, and it's easier on your stomach. But that also is going to make it take longer to dissolve. Now, I don't know about you, but my mom, if I had a sore throat, would say, here, chew on this aspirin. It tasted terrible, but it was fast action to the sore throat. And the same thing where your heart is concerned. It can slow down and help that clot, if there is one, to pass through. Can I tell a story about my sister-in-law?
Sure.
My sister-in-law was found, oh my goodness, on the floor of her apartment building. Her neighbor called 911, they came and got her. She had absolutely no symptoms. Took her to the hospital, which was only about 10 minutes away, but lo and behold, she needed a quadruple bypass. The only symptoms she said she had was that she couldn't swallow. She had trouble swallowing. And 4 stents later, she lived several years. So you need that immediate attention.
Right, and, so let's say you're at the hospital now, and maybe the symptoms have subsided, or the EKG that they took in the truck, they do it again, and it's looking normal, but we feel terrible. We know our bodies. And all too many stories that I've heard, because I've been around many heart patients, women and men, is they say, well, you're just having an anxiety attack. Yeah. Or, you're nervous, or, well, we'll give you a Valium or, something of that type and send you home. Do not let them send you home. Because, you can insist on staying there, and all too many stories of women, unfortunately, who've gone home and had another heart attack and didn't make it. One of our women heart, Lizanne, one of our women heart champions in Savannah, was visiting her sisters down in Florida for somebody's birthday, and she had these other odd symptoms, the fatigue, I think she had pain in the jaw, went in the hospital, and they did try to send her home or back to her sister's house, and she said no, and then the symptoms came back again like 10 minutes later. So this is golden, and follow it too, really, just don't. I even have a neighbor, and it just pains me to know that, I was next door while this was happening. She actually was having a stroke, and she said, well, I wanted to take a shower and got clean clothes on. I didn't want to wake up my husband until the last minute. And I was going, Linda. And she's having she's recovering, but, every minute counts, whether it's a heart attack or a stroke. So how can you take advantage of Women Heart or get involved with us? Again, in your bag, you'll see a little flyer that talks about heart scarves. You see Becky wearing her heart scarf. She had misplaced the one she got originally. So she has a new one today. Elaine has hers on. I don't know, I felt like I had so much stuff going on here, including my dangle earrings. I didn't wear my scarf, but I have a scarf too. If any of you ladies in the room are a heart patient, you've had a heart attack, surgery, maybe have a heart and valve problem that may not still be resolved. Anyway, we would love to initiate you at the end of the meeting with a heart scarf, make you a heart sister. Now, where do these heart scarves come from? They come from all over the country. People, groups knit and crochet them. They're pretty simple instructions. A lot of people, like in Savannah, we had a group of seniors who have, made scarves, and they knit or crochet, but we collected the yarn for them, so there was no cost to them to actually
Hint.
make scarves. Hint.
If y'all want to start a
Yes.
little heart scarf group,
Right. Yes.
you can don't. What you have to do is donate the yarn. So that's the only catch.
Yeah.
But you can. We'll give you the dimensions
Yeah.
that most of the heart scarves are completed in,
Mm-hmm.
and we'll send it off to
Yeah.
Women Heart for you, and they will sterilize it and send it back with their label and instructions in a nice neat bag, so that you know it's clean and you don't have to cringe because somebody else's cookies is on it.
Right, yeah, and they go, your scarves that you make might end up in San Diego, they gather them all, there's a center in North Carolina where these all come together, and they autoclave them, they clean them, put them with little info about where they came from, and a lovely label, seal them up, and then we can send for them to keep our supply going, just like we send for bags. We also, these bags also come in Spanish language, and our newest, Women Heart champion, who is from Rincon, she just got trained in October up at Mayo Clinic. She's Spanish speaking, well, English and Spanish, she's, third generation or something, so her English is great, but she goes to a lot of the Spanish speaking churches and community centers. So this bag, if you can imagine it, the word Women Heart is the same, but everything else is in Spanish. So that's,
if you like to talk to people and you'd like to be a Women Heart champion, you can go online to that website and say, sign me up. The trainings are offered twice a year. There's one session that is in person, and you travel up to Rochester, New York.
Minnesota.
Thank you.
Minnesota.
Thank you. Yeah, my son-in-law is from Rochester, so New York, so I guess so. Or, as I did, you do it online. We are always looking for the support of the men. Okay? As soon as I became a Women Heart champion, so did my husband.
Yeah. Right, yeah, exactly. And February is Heart Month for everybody, Heart Association, us, everybody, but we do programs like this all year long. We have our Women Heart business cards with our phone numbers and email. So if you would want us, or there are other churches in the area or community organizations that would like us to come and talk and share this information, we're delighted. If you are interested in becoming a Women Heart champion and or get going with the heart scarves, please contact either of us and we'll be very hands-on. And if you do knit or crochet scarves, we'll come and pick them up and send them out to North Carolina where they love them and take care of them. There's another flyer in here called Sister Match because Women Heart has found that women who have similar heart disease types, and there are many different types of heart diseases, as you're probably aware, sometimes it's nice to be paired with another woman who could be anywhere in the country, so you talk by phone. If you can't get to a support group meeting locally, talk by phone. There's somebody who's had bypass surgery, or somebody who's had a heart attack and recovered. Somebody with a disease like mine, which is a little bit more unusual, hypertrophic cardiomyopathy, valve disease, they're all different. And it's kind of nice to get matched up. So this is information about how you can get matched up. Or again, you can call or email Elaine or me. Again, our cards are in the bag. Another thing that I want to emphasize that we're very, very in favor of is cardiac rehab and following, a heart attack, a diagnosis of one of the rhythm diseases, arrhythmia, or anything like that, and certainly any surgery. I did my cardiac rehab at Candler Hospital. I don't know if you have a cardiac rehab here in Statesboro or not. We should find out. Yeah, but it's excellent, because what you do is you go for 36 weeks, 3 times a week, an hour each, and you start, they set you up on the different, there's a treadmill and about 3 or 4 other devices. And the first time you go on it, you literally do it for like a minute. Okay, minute's up. By the end of the 36 weeks, you're able to do 15 minutes on each machine, with a break in between. And they're very conscious of, there were always folks there who had also had heart disease and diabetes. They would also check your sugar before and after the exercise, to make sure that you were okay.
Whether you have had a heart attack or you are trying to prevent one, I encourage everyone to get outside and walk. Okay, if you have a dog, you have a great excuse. If you don't have a dog, take your neighbor's dog out. Start with at least 10 minutes, do that for a week or 2, and you'll see a difference. The 3rd week, you should be adding another 5 minutes. So you give yourself a little bit more challenge, and you keep doing that until that becomes easy. Add another 5 minutes until you're starting to keep up with us. Okay? please
And
promise,
what's that?
excuse me,
How long do you walk?
begin with 10 minutes. If you think that's too much, start with 5.
No, how many minutes do y'all do? Now,
When you go for your walk, how long is your walk?
How long, when you go for a walk, how long does it take?
No, she wants to know how long you go.
For me?
Yeah.
Well, I just had a near-death experience. So yesterday I took a walk for 25 minutes and I went a mile and a half. Before that, and I went 2.5 miles an hour. Okay, before that, way before that, I would go about 3.5 miles an hour, and I could sustain that for an hour, but I was a personal trainer. So somewhere between the 5 or 10 minutes and an hour and a half of walking, you have to go for what's right for you. Listen to your body. It's not about competition. It's about staying healthy and being good to yourself. Okay, so it doesn't really matter how far and how fast I can go. It's how you can do it.
Yeah, and also, you kind of gauge what the rest of your body can take. Like, I don't like treadmills. I do like walking, but I don't like treadmills. Never have, never will. And then I've had 2 hips replaced, left in 2019, right in 2020. So I went through the run up to the pain of that and recovery and so forth. So the machines that I go on, I go to the gym. It's part of Candler Hospital, full wellness center. I go at least 2 or 3 times a week, and then I walk in between. And I have my favorite pieces of equipment for, weight and muscle. And I love the rowing machine for some reason. I don't know, I just love it. And but I'm not pounding, it's, and then there's another machine where, again, I'm not pounding on my joints because my knee's starting to act up. And having nursed my husband through 2 years of knee replacement, I don't want to go there if I don't have to. So, yeah, and these things about, I think the Apple made it up that you have to do 10,000 steps a day. Apparently that's full on me.
Have you all heard about Fitbit? Okay, so the people who invented
With the
Fitbit
Fitbit, who did
were
it?
sitting around in their nice little offices, and they were probably 20 or 30 something, and they were asking each other, well, how far do you think we should recommend? And literally, they pulled the number out of the sky. Oh, 10,000 steps a day sounds right. No, it's not realistic for everyone. It's a big challenge for me to get 10,000 steps in every time I go out for a walk. Start with 5 or 10 minutes. And remember, there is no competition. Doesn't matter how far. It just matters that you do it.
So any questions, comments, anything you'd like to share? I mean, what's great about Women Heart is we share experiences with each other, especially locally. We go, I don't like my cardiologist anymore, do you know somebody that like better? All kind. It's great to share because we know we're the experts. We take charge of our hearts, and then sometimes we're in charge of our spouses or relatives' hearts and so forth as well. Any questions or comments?
I don't trust the echocardiogram, the other things, because mine I was really good. Everything on the monitors, I was good.
But
But then when I was operated on, I had 5 heart bypass.
yeah, you mentioned that earlier today. So had you had a catheterization? Did they look?
Oh, yeah.
No.
Well, that was,
That oh,
led to it, yeah. There's, in,
Cadillac of the,
pardon?
that's the heart cath is the Cadillac of
Yeah, they
diagnosis.
literally can.
Everything else is just,
Yeah,
can only look at one particular thing.
right, and
And
even,
it doesn't look at.
yeah, an echocardiogram, and I've had plenty of those. I've also had something called a TEE,
Right.
called a transesophageal cardiogram, because in order to really see the heart, your ribs are in the way here. They can actually, they knock you out, a little bit of anesthesia. and they go and take a picture of the heart without the bones in the way. Now, they did that for me because, this was after my incident, they were really working me up, but, absolutely. And for any of you who go online, I actually gave a TED Talk. I don't know if you know what TED Talks are, but they're talks about all kinds of different topics. In 2016, if you go on YouTube and Google my name, Murem Sharpe, I gave a talk called "Let's Do Mammograms for the Heart." What did I mean by that? And thank you for bringing up, the issue of how do you really get a good diagnosis. Mammograms, we all are entitled to them, age 40 and older, or sometimes younger if there's a lot of family history, but you don't even have to prove family history, symptoms, nothing. You get a mammogram. Probably most people don't know how much it costs because it's covered by insurance or there are free vans going around, but it's not expensive and not pleasant, but not expensive, and once a year it's a good idea. A cardiac heart scan, also known as a calcium scan, is about the same cost, and it's a CAT scan. It's like you're just lying there and the scanner goes over you. It gives you, the doctor, a number associated with how much calcium they see in arteries around your heart, and that has served to be a much better, earlier predictor of plaque buildup and possible, which is what you must have had, is blockages. And so in my TED Talk, I said, why don't we, because this is the #1 killer of women and men. Cardiovascular disease is, among all the heart diseases, the #1 killer of the #1 killer. Why aren't we spending $100, $200 or getting, insurance to pay for a calcium heart scan? And that's the message from my TED Talk. I told all my heart story, but I chose to talk about cardiovascular heart disease because that's the one that's, the most prevalent out there. So, anyway, we just know that there are still scientists hard at work, coming up with ways to perhaps replace tissue cells in a damaged heart. We're not there yet. So please take charge of your heart. Thank you very much.
Before we say goodbye, I had 2 of these. Is there another one someplace? Yeah, okay.
I'll give you a couple.
Thank you.
May I give you a couple of extras?
Thank you.
For,
Thank you.
and we would love to give you